Tambra.
Good afternoon, Chairwoman Henderson. I'm Tambra Raye Stevenson, founder and CEO of WANDA, Women Advancing Nutrition, Dietetics and Agriculture. I serve as the health chair for NAACP DC branch, formerly on the DC Food Policy Council, a member of the Tufts Food and Nutrition Innovation Council, and Milken Institute Food as Medicine Advisory Board. The last time I spoke in front of the council was urging the expansion of doula services east of the river, seeing the facing reduction of labor delivery services, yet the more birth babies in the district. So I want to build on that conversation by highlighting another essential part of maternal health that deserves greater investment, which is access to nutrition and community partnerships that make healthy pregnancies possible. The issue is quite personal. As someone who birthed 2 babies needing Community Hope Birth Center and Washington Hospital Center when I had emergency C-sections. But my nutrition background greatly benefited me from having healthy babies. And families need a full continuum of options from community-based prenatal support, birth centers, and hospital-based specialty care. And a healthy pregnancy is not created during birth, but before conception, and continues well in postpartum period. Yet nutrition remains one of the least integrated components of maternal health beyond WIC. Despite its influence on gestational diabetes, hypertension, anemia, as my colleagues have mentioned. Last fall, WANDA piloted NOURISH Maternal Food as Medicine in east of the river to help with access to trauma-informed, cultural, meaningful culinary nutrition education support, grounded in lived experience in partnership with Dreaming Out Loud, training birth workers as those who testified today, serving our families in DC. And we found that the doulas and community health workers and other trusted professionals are eager to receive cultural relevant nutrition guidance to support clients, but they need sustainable support, evidence-based training, and strong connections to the healthcare system. The Milken Institute Feeding Change Initiative has shown that community-based organizations are essential partners in food as medicine because they build trust, improve partnership, bridge the gap between healthcare systems and everyday life. And if we want healthier babies and pregnancies, we must not only invest in clinical care, but in trusted organizations that help families put healthy practices in action. So as the district evaluates maternal health investments, I encourage the council to view nutrition as a core infrastructure, not an add-on option. We should invest in CBOs that provide cultural responsible nutrition education, strengthen the partnerships between providers and organizations. Finally, I want to respectfully ask that DC Health and Healthcare Finance with the following questions. How is the district incorporating food as medicine into maternal health strategy? How are CBOs being supported as implementation partners? And how will the district measure these investments are improving outcomes for moms and babies, especially east of the river? Because the first food of medicine for a child is through the mom, and healthy moms require more than health care, but nourishment, trust, and community. When we invest in all three, we give each child a healthier beginning and every family a strong future. Thank you for the opportunity to testify.
Thank you.
Intervention, it was over a course of 4 weeks. We had every topic from gestational diabetes to hypertension, also case-based studies rooted in DC communities, so Ward 8, and also providing resources to those attending. Many of them were birth workers who had day jobs, and so we conducted it in the evening at the Marionberry Market before it launched. We had a registered dietitian, also a mom, chefs who are also moms who could talk from their lived experience. We incorporated African diasporan foodways, Caribbean, African American recipes. We had them participate and actually conduct the recipes as well so they can gain their own kitchen confidence, being able to help replicate these menus with their patients. And for many who were birth workers and also food providers, it helped to enhance and build their own confidence. Many of them in our baseline said they had no to low nutrition education, and with the cost of academic training and student loans. We know that nutrition is cost prohibitive for many folks, and so being able to democratize education, providing it in community and safe spaces, we were told they would love to do it again, which we're looking to bring it back this year. But again, it takes funding, and we relied on Dreaming Out Loud to help cover those costs, give scholarships to make sure that no one had to take any money out of their pockets. But we did know that they would have loved and would have paid for it if we did put a price tag on the program as well. So we're taking their data, doing both pre-post testing and interviews to help expand and make a more robust, longer program that's also hybrid, in-person and virtual, in order to meet them where they are. We did allow them to bring their children, which only added value to show this is why we're here to do this work. And so we say no mom should ever apologize for bringing their children along, because it helps to make a more rooted, grounded, and robust experience of why we do this work every day.
Yeah. Well, that sounds great. It also kind of reminds me of once upon a time, before the Republicans took over, there was this program called SNAP Ed.
Yes,
which,
I was an FNF educator.
Yeah, so it sounds like you guys are sort of picking up and also kind of expanding to this very specific population, something that used to be federally funded, and I think are super helpful, to the point that you said, like, nutrition is helping make healthy babies. It's core, not an add-on, and more work needing to be done in that arena, just in terms of helping people make healthy choices. I don't know. Yesterday I ran to Pret after what was too long of a meeting in this building, and I didn't have my water bottle, but I was thirsty. I was going to sit there and eat, and so I was like, okay, let me look at the options. I could get the lemonade for $5.49,
right? Or
I can get the 12-ounce can of Coke for like $3, which is expensive. And I was like, this is just, the lemonade is clearly the healthier option, but it is also the most expensive option, such that we're just pushing people into,
yes, it is a system designed, and that is why we have to incorporate nutrition professionals in a part of this maternal health conversation, which many of times we have not been a part of the process. It's critical that we're part of the policy making process, because from the maternal health policies I've seen, they have very light watered versions of what nutrition truly means. We're more than a cooking demo. We're trained literally one class away from being a chemistry minor. And so for us, it's equally as important to understand, just as much as we need a doctor, we need someone who also knows how to grow the food, but could cook and not cook out the nutrients in the food, and understand how do we make sure that families feel comfortable when they get the food, prepare it, and if they can't, how do we train those who are the culinary and birth worker professionals to make sure they can provide that support for those families. Because in the end, we may not be the hard savings that is apparent, but we are the soft savings in the beginning when we think. We are not simply telling folks what they already know. We're helping to say you are worthy, you're deserving, you are valuable to eat the foods to make a healthy body, to live your God-given purpose. And people need to understand that basic decency of what it means to have culturally competent nutrition educational professionals, and training those to be the next generation to follow in our footsteps.
I want to leave it there, but I do need to ask some additional questions. But thank you for your passion, and thank you for the work that you're doing. I love that the nutrition piece of our work in government is in the health committee, and sometimes